DixonMyV.com. Uh, how do you How do you feel the new medical health scheme for civil servants will impact them, and does the policies vary based on the area in which one works?
Good, very good question, young man. It will bring enormous benefits to them. Firstly, it should assure them that they have the opportunity to maintain maximum health, good health, as they serve within the public service. And I say that because they have the opportunity to have their annual checkups, and they don't have to wait until they fall ill to know that they are seriously impairing their ability to perform and serve. So that should be the motivation, in my opinion, for them to do better. Also, realistically speaking, this is a time of great challenge. Our people are experiencing serious hardships in some quarters. The less money that they are going to take from their pockets to pay for the doctor, or to pay to the surgeon, or to have serious illnesses being treated, the less money will come from their pockets, the better it will be for them in terms of improving in some way their disposable income. As I said this morning, at the moment the government is not able to provide the public servants with an increase in wage, increase in salary. But we can increase the benefits that you derive so that you would be called upon less to use whatever you have in order to maintain good health. And then when you look at the enormous new aspects of the beneficial schemes that have been brought into place, it could only motivate people to come into the public service and perform well. And I want to emphasize finally performing well, because as I said this morning again, we have provided these additional benefits and opportunities for you. What it is that you're going to give back to the people of this country whom you serve. Are you going to give greater efficiency of service? Are you going to respect the people that you deal with on a daily basis a little more? Are you going to have a greater commitment to the job that you have to do in serving the public that is responsible to a large extent by paying for the increases in these medical benefits that you're having? So I think it is a motivation to our public servants to perform better, to be much more efficient in their service, and to treat each other and to treat the fellow men, people of the country that they serve, with better and greater respect. I think it is a very important question that you've asked. Did I get all of the question answered?
But does the policy...
The policy does not discriminate. It goes across the board. If you are a civil servant, a professor at the college, medical doctor, the prime minister, minister of government, the lady who is cleaning the floor, the messenger who goes out with the messages, no matter what job you are performing in the service, everybody gets the same treatment. Every single person gets the same treatment. This morning, there was a young lady who asked the first question at the briefing session that we had. She said, gentleman from the broker company who was conducting the answering question sessions. Well, for those of us who are paying a private company for air ambulance service, Do we still have to pay them since you're now providing this service for us? And that's a very fundamental question. And my answer is this. I didn't answer there because it was not a question to me. But I said here, what is the point of paying for an air ambulance service that is expected to take you from here, the Joseph and France General Hospital, to Miami, to Trinidad and Tobago, when you don't have the money to pay for the service, the medical service there in that institution? So it is not enough to just simply have an air ambulance service. I'm not going to tell you to stop paying. It's your choice, but you must use your wisdom here. What is the point of paying for an air ambulance service to take you from St. Kitts and Nevis to Trinidad? They deposit you in the hospital, but you have no money to pay the doctor for the treatment that you're going to get. That's why this is a full coverage system. It not only improves the amount of money that the doctor will be obtaining for doing the medical work that he has to do with the patient, but we have put in place the opportunity for you to get from here to there if the treatment that you need is not here in St. Kitts and Nevis. We give you a full coverage. Not only that, last part of your question, we are also saying that we would want your family to be covered. If you alone and one dependent, I think it's fine. Every other dependent up to 4, there's a certain amount additional that you would pay. So we are trying to cover the family. No longer is just the government employee, but those members of his family can also be covered in this new arrangement so that they too can benefit from the employee who is part of that household from which he comes. And yet again, question is, when you would have retired from the public service, what then? You can continue with this medical scheme even when you have retired. At the moment, we believe that certain category of workers, those who are government auxiliary employees, I think they have to pay $75 after you have retired. My question is, would that category of worker be able to pay that $75 even after they have lost their wages, but they're getting a pension? And we are looking to see how we can reduce that for that category of workers. The government auxiliary worker, those who are doing the auxiliary support services for the government to perform its services and duties to the people of this country, the citizens of this country. So we are still working on it to even make it better for our public servants after retirement. Good question.
What is it costing the government to provide these health benefits?
You know, Valencia it is?
Valencia.
Oh, Valencia, sorry about that. I don't even know. I don't remember the figure. But let me tell you what. When a few months ago we started this exercise of consultation, we said to the insurance company through our negotiators with the brokers that government does not intend to pay much more than what it is already paying. I think it runs into over $1 million. I can't remember. Somebody should text and get the answer to us here. But I said, listen, I don't really have much more money to give the insurance company because all around the world, packages were being sent to us for improvement. but we wanted to use the package from our own indigenous insurance company. And so we said, listen, work with us. We're getting from Nagico, we're getting from this, we're getting from Sagicor, where they are offering us improved benefits for the same amount that we already paying to you. So let us sit down and talk. And they sat down and we discussed. And so the amount is not much more, if it is more. I'll get you the figure later on.
Listening to you with the situation concerning the increase or improved benefits with the medical scheme, with the NCI, I would like to say it's highly commendable. However, has some considerations been given to those individuals like the vendors who are not civil servants? What advice would you give to them pertaining to this scheme, how they can get involved in it, whereby they can have someone who's remaining in their pockets when they are ill and need further medical treatment or advanced medical treatment? That's my question to you, sir.
Right. I think it's a very leading question in the sense that it points us to the future. The government intends to introduce what is called the National Health Insurance Scheme. And the way we thought we would want to do this is expand the operation of the Social Security scheme to include all nationals in this country. It will also entail, I must advise you, a contribution from the vendors' pay packet, so that they being categorized as self-employed persons, paying their Social Security like any other self-employed group of persons, and like any other government and non-government employed person, they would make a small contribution as they would make to the Social Security, and then they would be covered for their medical support. So that is yet to come. But it will come, because you are right. The government employees are not the only ones in this country who fall sick. And so we would want to cover everybody, but it will have to be a contributory scheme, as the case may be. Valencia. I have the information to your question earlier. The amount it is costing us is EC $4.5 million every year. And we are covering 4,200 persons who are public servants, and of course their families, those who have the family package.